Welcome everybody to the launch of the Guide for Green Walking in Mental Health Recovery. We're really pleased and excited to have such a large and diverse group of people joining us, and our wonderful panelists, who I hope you can all see in front of us. So my name's Frances Mortimer. Very nice wave. I'm Frances Mortimer. I'm the Medical Director at the Centre for Sustainable Healthcare. There are several members of the CSH team here. So you could see Rachel, our Director, Jacob Kozanowski, who's been, many of you will have come into contact with, working on the Green Walking project. And then we're joined by a fantastic group. So we've got Catherine Thompson joining from Edinburgh, who's an expert on green space and health. We've got Dr. Geraldine Strategy, who is has many eminent roles in mental health nationally. Also Dr. Adrian James, who's the incoming president of the Royal College of Psychiatrists. We've got Rachel Banister, who's a mental health advocate and a carer representative at the Royal College of Psychiatrists. And we've got Julie and John here from our from some of the Green Beacon sites who have started walking groups. Have I forgot anybody? Ben and Inga. Inga is part of the CSH team, and Ben, who you can't see but whose name is there, they're going to be helping with any technical questions. So if anybody is looking for help with sound or technical issues, please do send a message to Ben or Inga, and I think you can do that through the chat. You should all have received a programme for today in the email that earlier on, and we're going to be, we've got quite a packed programme with a number of presentations and an opportunity for questions. We're going to be using the Q&A function for questions. So I think if everybody should have an icon at the bottom of the screen labelled Q&A, and if you have a question to put to any of our panellists, please post it there, and you may also be able to comment on questions that other people have posted. We're recording the session today so that we can use it as a resource going forward, which all our panelists have given their permission for. What else to say? I like to say thank you to the Network for Social Change, who funded this project and made this possible and funded the event today. So very many thanks to that. We will be sending out the guide itself at the end of the webinar by email, and we would also encourage you to all support the project on social media if you can, and I'm just posting the some hashtags that into the chat there that would be wonderful if you'd like to pick up and use today. So without further ado, I'm going to hand over to Adrian James from the Royal College of Psychiatrists. Thanks, Adrian.
Well, thank you, Frances, and welcome to you all. And thanks for joining us to what I think is a really exciting day, the launch of the Green Walking in Mental Health Guide. I'm delighted to co-host this event along with the Centre for Sustainable Healthcare, and I'm proud of our long-standing relationship with them. Sustainability has been high on the college agenda for the last decade, and I do want to pay tribute to a number of people who have led us on that path, particularly Daniel Morn and Phil Davison, and also to welcome our new Associate Registrars for Sustainability, Lisa Page and Jacob Kronowski. We've recently set up an expert reference group at the college in response to the climate and ecological emergency. And I'm going to be chairing that as the new president. It's the only group so far that I've agreed to chair, and that is a sign of how important I see this issue. And we want to be bold, and green walking is part of that. I'd like to thank all of you who've been involved in developing the Green Walking project and the guide, especially Jacob and all of those at the Centre for Sustainable Healthcare. I welcome the encouragement to set up green walking groups absolutely everywhere. And this guide helps us along that path, literally. So over to you, Francis.
Thank you very, very much, Adrian. And it's been wonderful to collaborate with the Royal College of Psychiatrists, which we've been doing for several years now, and very fruitfully. I'm just going to put up some slides to talk through. Sorry. Okay. This is where I'm always being told off by my husband for having all my windows open at the same time and not. There we go. Okay. So I just briefly wanted, if I may, to introduce the Centre for Sustainable Healthcare in our work and the project itself. So as I say, I'm the medical director there. This is a picture of most members of the team. So we're not a huge organisation. We're based in Oxford, but we've got increasingly large numbers of people working spread out across the country, and so we're moving to more of a virtual system with the lockdown, which has been quite good for us in that respect. Just to tell you a little bit about our work, we obviously work on sustainable healthcare, but we've taken a particular interest in that time in thinking not so much about the estates and the facilities and energy use and things in the hospitals, so much as the design of care and the engagement of health professionals in thinking about the resources that they're using in their clinical practice, engaging patients as partners in their own care, and changing the culture of sustainability of healthcare to incorporate sustainability. So this is a little infographic in a way of our specialty program, where we work with different clinical specialties. We often, where possible, try and work with a fellow who links up with people in all different parts of the different units around the country, who all undertake local initiatives, and we learn from that and support it with research and other work. We also do quite a lot of work in education, so working with medical schools, but also with other health professions education, and we're increasingly offering training ourselves to people from across the system, and getting learning how to do that online, and extend our reach. One of our other big projects has been the NHS Forest, which is about focusing on and making the most of green spaces on and around hospitals and GP surgeries and other NHS land, and opening those up to staff and patients and local communities. Also use the little map is an example of some of the work we do on creating walking routes from GP surgeries, and integrating walking into being part of healthcare. And a major concept that we have kind of developed and embraced in our work is that all healthcare should be seeking to gain the best possible outcomes for patients and populations in terms of their health from the use of environmental and social and financial resources. And so that those three are often called the triple bottom line. And as I'll tell you, I think the green walking really scores very well across all of those different elements, and that's one of the reasons that we're so excited about it. Adrian mentioned Daniel Morn, who was the Sustainability Fellow for the Royal College of Psychiatrists, who was based with us for 2 years, and we worked closely together to develop the thinking around sustainability and mental health. He did a lot of very valuable work. This is just a little taster work with the Academy of Medical Royal Colleges to look at how doctors can be better custodians of resources. work on commissioning, how we commission mental health services that are environmentally, financially and socially sustainable. I hope that you will have all come across our networks. There are at least 2 networks that are directly relevant to this project on this network's website. So that's the Psych Susnet for everyone interested in mental health and how to make it more sustainable, and OT Susnet, or Occupational Therapy Susnet. So there's a lot of people engaged and resources being shared through those networks. Through the work of the CSH and Royal College of Psychiatrists and Daniel, we engaged in 2015 with a large number of organisations, including those listed across the top of here, and they all signed up to a joint position statement that they would all strive to improve the sustainability of mental health care, using these principles that are listed here. So prioritising prevention, empowering individuals in our communities, improving value by making sure it's the right intervention at the right time for the right person, and thinking about the carbon of the care that we give. And I think that, again, green walking, when you look at it is preventative. It's actually benefits the staff who take part as well as the patients and their families. It is empowering. It's something that helps contribute to people's recovery and their resilience in the future. It is valuable. I think we'll find out more about how it's valuable actually in therapeutic sense, as well as promoting well-being, and it's very low carbon, cheap. After Daniel's fellowship, we carried on working with the college and supporting psychiatry trainees in part-time roles to develop sustainability projects. And this is a picture of one of the meetings at the college of the scholars. And the person you can see here in the white, that's Emma Brandish, and she was actually the person who got us thinking about green walking properly in the first place. She worked for one of her several projects that she did in her year. She just started a staff and patient walking group on her ward, and we thought, actually, this is really interesting. It's sort of much more than the sum of its parts. And from that came the Green Walking Project, Green Walking in Mental Health Recovery. Our mission is to provide respite and healing to people receiving inpatient psychiatric care through walking together in nature. And we have been supported by two grants from the Network for Social the Network for Social Change, and we've been able to take forward the project through working in partnership with the Royal College of Psychiatrists and with the support of several other organisations. The Royal College of Occupational Therapists have been critical, Open Space and the Maudsley Charity. I'd like to give thanks to all those for their support. One huge boost that the project then received was the unexpected appearance of Jacob, who got in touch just as we were at that and said, we're really interested in green care. He'd started a walking group in his own practice, working in Bethlehem. And together we got really excited about it, and we kind of went almost a bit off-piste with the grant that we had was to develop a guide, and we got involved in a lot more, as you'll see. So just running through very briefly what the initiative has entailed over the last 2 years. We did a literature review on walking in health and green exercise, and followed up with a telephone survey of mental health trusts just to try and understand how much walking was already going on and what the issues are around that. Learning from them, we developed 8 case studies of trusts that were already doing it. A focus group was held with patients and carers at the Royal College of Psychiatrists to understand their perspective on the initiative and what the barriers might be. We decided we were planning to develop the guide and then kind of pilot it with 2 sites, but we ended up recruiting 8 sites because we felt the interest in the initiative, and also we wanted to understand the differences between rural and urban locations and different contexts where people might be doing this. So these are the 8 fantastic Green Beacon sites that we've worked with, and we've got, I think, participants from many of these on the call today, and we've got some presenters from Cornwall. That's John, and Kent, which is Julie. So Jacob organised a fantastic get together of that and of those the people from the Green Beacon sites last year, which was incredibly thought-provoking, looking at the relationship with between walking and the quality of the inpatient experience, and the health benefits, and the practical aspects as well. Over a 3-month period, the 8 sites organised a weekly walking group. So 83 out of a possible 100 walks went ahead, and each walk involved filling out survey from the walk leader, but with input from the participants. There were a lot of additional surveys finding out how the group was regarded by ward staff and so forth. And so thank you very, very much to those pilots, those Green Beacon sites, for all that, because it generated an absolute wealth of learning, which we have tried to translate into the guide, various case studies and other resources. Here we are, we're at the launch event today, and part of leading up to the launch and going beyond is working on is promoting the concepts in the wider media. So a snippet of the learning. I mean, I think we all thought walking in green spaces is kind of a good thing, but we've been blown away by actually how it's more of a good thing than we even realised. So for the patients, it's a time to be in a different space, slightly a shift in relationships, where you don't necessarily have to think about your illness, and you can perhaps, for many people, can reconnect to the person that they are when they're well. For the ward, it can actually help. It can help, to change the atmosphere on the help and on the ward, and help some of the most unsettled patients, in fact. And it's often those that can be difficult to arrange leave to take people out of the ward if they're considered a risk, but it can be that those are the people who stand to benefit the most. So it's something that I think we need to look at pushing to see where we can get to with that. And the therapists and all the people who've attended the walk have told us that it really does create a different space, and that can be a therapeutic space, and it can strengthen the relationships between between the staff members and the patients, or the patients and one another. You're going to hear more about this directly from the people involved. So but one thing that just struck me really powerfully is this quote from somebody who took part in the walk: "It feels like freedom," and I think those are probably the people who need it most, is that feeling of freedom. That's kind of the perspectives from the individual players, but I think even more so, it's created a platform for us to think about what we would like to make better about inpatient care, and how we can work together across boundaries. Should walking be considered, a therapy option alongside, somebody could do art therapy or music or green walking, or is it actually part of self-care? Is it part of just well-being, to be outside, to be moving in the same way that we would encourage people to get up, get dressed, to keep themselves, look after themselves in other ways. And what about the pressures of wards? Is it really not possible to take people out because of the staff shortages? What does that tell us about our mental health system at the moment? And I think, what about the relationship between the different staff groups? Could we use green walking to make holistic care a shared endeavour across the different professions? And I think that people will want that, and if green walking helps with that, then that's a very powerful thing. So finally, I'd like to say thank you. This is a lovely picture taken at the summit that we held last year. So many of the people in this picture are on the call today and have been contributing so much over the last year or 2 years to the project. So I'd like to say thank you very, very much to all of them. Right. So I would like to hand over to our keynote speakers now. What we've got planned is we've got 2 keynote speakers, Catherine Ward-Thompson and Geraldine Strategy. And then there's going to be an opportunity for you to put questions to them, or for us to pose your questions to them in the Q&A session just after, which is going to be chaired by the CSH Director, Rachel Stancliffe. Catherine is a Professor of Landscape Architecture at the University of Edinburgh, and Director of the Open Space Research Centre, where she researches on inclusive access to outdoor environments and health promoting environments. And we're very, very pleased to hear from you, Catherine. Please do go ahead.
Good morning. Thank you. I'm just setting up my presentation here. Excuse me a minute when I just...
You're having exactly the same experience as me, Catherine. You think you've got everything ready.
Yes. It's the sequence with which one does things that turns out to be
lovely.
Oh. Okay. I think, have I now got something that shares the screen with everyone? Good.
It's perfect.
Lovely to see you all this morning. It's really good to know that I've got some Scottish colleagues here as well, including some people who have been working with me to try and see how we can support people coming out of hospital or care facilities to keep walking after they've had that intensive experience. So it really ties in my work recently very well with the ambitions of green walking. I'm a landscape architect, so coming from a very different background, but my work in open space at the University of Edinburgh very much brings together understanding of the physical environment, particularly the outdoor and the natural, and people's health and well-being in recent years. I'm going to give you rather a dash through research, and apologies that I can't explain the detail of all that I'm going to show you, but I wanted to give you a flavour of the evidence that supports the benefits of getting access to green and natural environments. And you can follow, you'll get access to the slides afterwards. You can follow up on any of this afterwards if you want. I'm very happy to give more details later. And just to say that there are 2 reports that I was involved in contributing to, which give a lot of the evidence if you want an easy way to look them up. The WHO European Region Report of 2016 on urban green spaces and health. I contributed to the review of evidence there. And then more recently in 2017, they produced a review of interventions to try and enhance urban green space to improve health. So those aren't obviously completely up to date now, but there's a lot of good material there if you want to look up particular references. One of the things that I wanted to underline was the fact that the Sustainable Development Goals that the UN has developed very much align with the World Health Organization's goals. And in fact, the World Health Organization sees these Sustainable Development Goals as the best way to get better public health. So if we look, for example, at linking good health and well-being to sustainable cities and communities and life on land, then just one sub-goal of sustainable cities and communities is about providing access to safe, inclusive and accessible green and public spaces. And in particular for women, children, older persons, persons with disabilities, actually we all need this, and coronavirus has just underlined how important good local access to these places are for us all. And there's nothing new in this. I teach landscape architecture history, and it turns out that for hundreds, if not thousands of years, people living in urban environments have understood the virtue of having a bit of greenery, even in the town, Rus in urbe. The ancient Romans promoted the countryside in the town. The 18th century public park movement, which Britain prides itself on having been a pioneer of, was very much promoted around the idea that particularly working class people living in dense urban areas needed access to green space for their health. And the public park developed, for example, in Birkenhead, very famously outside Liverpool, was seen as an opportunity to promote healthier living for people working in the mills of Liverpool and the docks and urban areas there. These wonderful quotes that you can see on the screen are focused on the cleaner air, among other things, that would be available in the parks in very polluted urban environments. But there was also an interest in mental health. And this quote from Frederick Law Olmsted, who worked with an English architect, Calvert Vaux, to develop Central Park in New York City, among a number of famous parks in the United States. He was very interested in the mental benefits of getting into green and natural environments that evoked what he called rural scenery. And you can see this quote here actually resonates very much with the difficulties of urban living and the stress of urban living today. And he saw these rural style parks as a very important part of psychological benefit, not just physiological benefit. And much more recent research, and I can't cite you all the quotes, but I've given you some references earlier, just reinforce the fact that green and blue space including water, beaches, lakes, riversides, is salutogenic, is health enhancing. And whether we look at mortality or indeed morbidity, there are many different studies across the world now which demonstrate that, other things being equal, having better access to green space is likely to be associated with better well-being. But we see this particularly true for more deprived communities. And so it's also been suggested that green space is equigenic, that the difference in health between the most economically deprived people and those better off is enhanced if they also have access to, good green space. And this nice chart produced by my colleague Rich Mitchell, with whom I worked on the Green Health Project a few years ago in Scotland, but this is a survey across a number of European countries, showing that, as we all know, there is a relationship between general health or mental health and your socioeconomic status. And the black line shows people who have great difficulty with accessing green environments near home. And the dark green line is those who have very easy access. And you can see that, excuse me, this is leveling off that imbalance. It's equigenic. Having more green space near home makes that mental well-being, gives people with socioeconomic deprivation a better chance of supporting their well-being. There are a number of mechanisms that have been proposed to explain what this relationship is and how it works. Physiological responses, psychoneuroendocrine mechanisms, the immune system, parasympathetic nerve activity, a whole range of very interesting research findings. But we also know that physical activity is the most popular thing that people do when they're outdoors in green and natural environments. Even if they also stop and have a picnic or something, they are most likely to be doing at least some walking when they're out and about, if they can walk at all in a natural landscape. And we know, therefore, that physical activity is good for our cardiovascular health, but it's also good for our mood and our stress. And another study here looked at, does having physical activity in a natural environment enhance your health more than doing the same level of physical activity in a built or indoor one? And the answer is yes, it does, very significantly. Again, a study by Rich Mitchell as part of a larger project we were engaged with. So if you're going to be physically active, being physically active outdoors in a natural environment is going to enhance your mental health more than doing the same thing indoors. Those psychophysiological responses that we see in the body turn out to be very important and influence both physical and mental health. And in a study we did looking at, excuse me, green spaces, how much green space people in very deprived urban populations, people out of work had, the access they had to green space near their home, we could predict healthier patterns of cortisol, indicative of the whole sort of psychoneuroendocrine functioning by the amount of green space around their home. What does this experience mean? Here are some quotes from people that we worked with in the Forestry Commission that very much talk about, you're not in consumption mode, you can get away from it all, you can calm yourself down. People clearly found getting into natural environments very therapeutic when we interviewed them. We've talked to older people, and not surprisingly, at all ages, we find a benefit in getting outdoors, whatever age we are. It's stimulating, it's a good, getting away from it all is often a phrase that people use. We also discovered that people have very vivid memories of their childhood. Even if they're teenagers, they're nostalgic for their childhood. Particular moments in green space or green environments that were very supportive. And there is a lot of research which suggests that having had that good access to green and natural environments in childhood becomes a resource that you can then draw on later on in life. So there is a challenge for those people who have not had good access to green space in childhood. It's harder for them to access that resource or understand the benefits that they might get from it. A study by a colleague, Jenny Rowe, working on her PhD, looked at forest schools and showed that a forest setting was particularly advantageous to young people with behavioural problems who'd been excluded from mainstream schooling, and a range of beneficial outcomes compared with a conventional school setting. And these young people with behavioural problems benefited more than young people without behavioural problems. We did a study which you can also access very easily online for Natural England, looking at wild adventure space in teenagers' lives. We talked to some teenagers in very deprived urban communities. They told us that there were important things about getting out in a natural environment. They felt very unwelcome in many public spaces. A natural environment is one where they might be able to do what they want, be how they want to be, talk to their friends in the way they want to. Freedom was important, but they also felt that they needed support from trained youth workers or other support because they didn't feel able to access these environments and enjoy them on their own. They didn't feel empowered to do that. And just to finish with touching on some very recent research looking at older people's engagement with the natural environment, mobility, mood and place. Some very pioneering research which has received a lot of attention from journalists, where we had used a mobile EEG system to measure neural waves while people were out and about in busy streets or green spaces. Very briefly, we showed that access to green space seems to buffer the response to the demand on attention that a busy urban environment needs, and can also be a very restorative place if you've moved from a busy urban environment where you have to pay attention. Particularly in old age, we often find that having to look out for traffic, look out for other people, different noises coming in, having perhaps less stable footing, can all be very unnerving, and a green space allows that attention that is demanded to be restored and enables us to cope better after that. And finally, we looked at people's access to green space over their lifetime in a cohort of people now in their 80s. We looked at where they had lived throughout their lives in the Edinburgh and Lothian region and how near they were to green space. And we found that for mental well-being, we saw a relationship between anxiety and depression limited to the most socially disadvantaged neighbourhoods, but green space during childhood makes a difference significantly to anxiety and depression in older age. The anxiety every decade of life near more green space made a difference in older age. So a really important message about the need for nearby good access for everyone, but particularly for our mental as well as our physical health. I'll stop there, happy to answer more questions later.
Thank you very, very much, Catherine. I think that was really wonderful. I'm sorry that I made everybody late, I think, by going on, so we're running already a few minutes behind. But can I please introduce Geraldine Strategy? Dr. Geraldine Strategy is the former National Clinical Director for Mental Health at NHS England. She's also a National Professional Advisor at the Care Quality Commission, and a non-executive director at South London and Maudsley NHS Foundation Trust, among several other roles. Geraldine, do you want to take the floor?
Lovely. Can you hear me okay and see me?
Yeah,
okay?
very well. We can hear and see you. Yeah.
Fantastic. Okay, well, first of all, thank you so much for inviting me. I feel very, very honoured to be invited to come and speak. We've had wonderful presentations from Frances, setting the scene of the Green Walking Project and all the brilliant work that she and Rachel have led for quite a while now at the Centre for Sustainable Healthcare. I was bowled over when Jacob contacted me and told me about the Green Walking Project that he's been the programme manager for. I was bowled over for a number of reasons. Firstly, here was a real implementation of a Green Spaces project, not with the easy way of doing things, but actually in environments and settings that took a huge amount of work to make happen. When he showed me the case studies that many of you who are speaking this morning had done, people who I am sure it took a lot of courage to persuade people that this was a good thing to do. It will certainly have taken a lot of your brain power finding solutions as challenges arose. So I wanted to convey my thanks right at the beginning of my talk to you for just making it so exciting that I was unable to say no, I won't come and give a talk when Jacob and Frances and Rachel asked me. So thank you so much for that. I'm going to talk more about, we've heard from Frances and we've heard from Catherine's wonderful presentation about what the world should look like, what benefits people. My talk is much more about how could we sustainably make it a reality in practice, in settings everywhere. Most of my life, and I live in a highly densely populated urban area. I think if I didn't know that green space was important before COVID, I most certainly do, having lived with it in a dense urban area in London. So I would like to start by asking everyone on the talk, or in the audience, firstly, what's your definition of sustainability for you as a person in your personal life? What's the quick thing that comes to your mind? Secondly, as you're thinking about what matters to you in terms of living in a sustainable, green way, has that changed with COVID? And thirdly, I want to ask you, in your professional lives, what does sustainability mean? What do we need to do as a nation of people to make sustainability happen, whatever your definition? I am going to address in my talk 4 things that I personally think are essential if we are to create sustainable systems that will make the implementation of the Green Walking Project and other wonderful projects promoted by the Centre for Sustainable Healthcare a reality. And these 4 are, firstly, how do we help society, which has begun to embrace mental health, become a sustainable fixture in the minds, in the DNA of everything we do as a society. Secondly, we know what we should be doing. We know what people tell us they need, but is it happening in the implementation parts of our society where all the resources are allocated? Thirdly, I have the privilege to sit on a board of something called Community Health Partnerships, which is about NHS estates and the role that they can play in creating sustainable models of healthcare and supporting it. And then finally, I want to talk about what I think is the essential third revolution in mental health, which is a very different way of thinking about how we use the Mental Health Act. And the Green Walking Project, I think, is almost a Trojan horse of how people can think very differently about that and what kind of care people need. So if I start by saying, Does our society, where you live, where I live, whichever one of our countries and jurisdictions we're in here today, does your society believe in positive mental health and happiness? Do the people around you, do the organizations you work with, do they know how to promote positive mental health? How to early on identify if you have environments or situations which will cause mental ill health? Do the people around you still feel that mental health is a stigmatizing subject they want to know nothing about? I think we've made enormous progress in the last 8 to 10 years. You know, we went from my usual quotas in 2012, when I joined NHS England as the National Clinical Director, we only had 10,000 people hitting on the main healthcare information website in England, NHS England. And of the 10,000 people that hit the mental health part of the website, what they were confronted with was 5 pages of information on the schizos clinics and the automatic link between mental ill health and violence and aggression. No wonder people, society didn't understand, stigmatized mental ill health, didn't want to know. But by 2016, 32 million people, half of the people in this country and many global partners, were accessing that site because it had been transformed. It had been transformed by service users, experts by experience, their families, and brilliant, gifted, multidisciplines of clinicians coming together and saying, this is possible. Mental health can be developed. Mental ill health can be treated. People can get into recovery. People can have different quality of lives if we get it right. Since then, we've had members of the royal family, parliamentarians, people still very committed to mental health. But one of the things that I suppose I've learned in my long life is that often things are very popular, but if we don't find ways to make them happen, if we don't find ways to implement them so that people can't forget, it quickly disappears. So my questions are really, how can we work even harder to make sure that in the DNA of every citizen, there is an understanding, the same as there now is about how to develop physical health, about how to develop their mental health. Our schools are beginning to recognize that children, because most mental ill health starts before the age of 14, that what happens in parenting programs and perinatal programs in schools is very, very fundamental to developing the health and happiness of populations. We've heard from Catherine about how in childhood access to green spaces is a real protective factor for later on developing depression and anxiety. How can we ensure that we can get that kind of access in society to people understanding? And my personal belief, so my second point, is it's about how we design and how we implement and how we resource our healthcare system. And that's a population health approach. I think the days when we in the health system thought that we were the architects of healthcare have long gone. We know that we need around us all the people who can make it happen, who've got the resources. What do I mean by that? I mean that we have a lot of evidence. I can show you 20 slides showing how in every single area in this country, planners in local government, in the health system, in their STPs, in their integrated care system plans, in their primary care network plans, people could calculate how many people are likely to have particular needs. They can identify the determinants, poverty, abuse, and some of the main ones, to the development of mental health. They could plan a system around that, but actually we don't. The information is all there, but people are not using it hugely. People from abroad, other countries, are full of admiration for our health system, our NHS. Healthcare free at the point of access. It's their assumption that because we work on a population basis, we can design and fund and resource our systems based on those identified proper objective facts, but we don't. So my question to you is, in your local area, have you looked at where the main resources for healthcare development are being allocated in the plans. Our green walking spaces, our open spaces, is social prescribing for everybody in the plans of your area going forward. Is it possible for you to inform that? In the school that your child goes to, what are they teaching about positive mental health and resilience? In your employment space, is there now, as there has to legally be, a proper policy for health and safety? So that in your employment space, the health and safety policy is not just about your physical safety, but is also about your psychological safety. How is that working for you in your place? Can you help promote that? Because my argument to you would be that unless we can bring with us society, we can bring with us local government, we can bring with us those huge local planning healthcare systems, and we could show them what really practical, sustainable, good care looks like, we are not at the table. I work for the Zero Suicide Alliance, and we've done a desktop review of all the sustainability STP plans, the future plans across the country. And it's concerning how mental health and green spaces does not feature in quite a number of those plans. What can we do to change that? So my third element was, have we got the right model of care as countries, internationally, as well as in the UK? Have we got the right model of healthcare? So the model of healthcare that's been promoted in our country, in England, both for the 5-year forward view and the longer term plan, is about care at home. Most of us would infinitely prefer, I think, I certainly would, to be in my own home and to be able to access the care I need, whether I do it digitally, whether I get it face-to-face, whether I get a phone call, whether occasionally I go and do a face-to-face contact with the clinician. Therefore, our healthcare system of the future has to be sustainably designed to be able to make that happen. I work for something called Community Health Partnerships, which is the Department of Health's estate company that has been developing and is continuing to develop what an estate, healthcare estate, what the building should look like, what the technology design should be, what the digital design should be to make care for people at home possible. Many of you may look in your local area and see the beginning of the buildings which mean that general practice care, community mental health team care, social care, citizens advice bureau care, as well as outreach clinics from the local acute trusts can be possible in the one place. I think it's utterly fascinating the impact that COVID has had in a number of settings. General practice has gone from a speciality where most contacts were face-to-face. And with COVID, it's about 5%. I know that in my world, the secondary care mental health world, there has been within 8 weeks the most enormous transformation to providing care for people through digital means. And I'm not saying that is at all ideal for everybody, but providing that kind of care that enables people to stay at home. But to do that, we would have as a society to understand what that means, to train people to do this very different way of working. I am bowled over when I see some of the estates that are being designed in inpatient settings in England. I had the great privilege when I first became a clinician in an area, clinical director in an area where there had been a very old institution. There were hidden corners for patients. There were sexual and other assaults on patients in that very terrible state. But I wonder now about the model of care that we still have in many places in England. Is it sensible to go on caring for people in estates that don't offer them the privacy of single bedroom ensuite bathroom? Is it sensible to have buildings where there is violence and aggression? Is it sensible to have seclusion rooms where people have almost no care there, almost no facilities? And should we go on with the current pattern of rising year-on-year detention of people under the Mental Health Act? Do we not know enough about the circumstances in our communities that might lead to people becoming unwell, that can offer them, through whatever means, early intervention, that can offer care that is informed by least restrictive practices? We have layers and layers of money spent in governance and other arrangements to make a sustainable future for people, to enable projects like the Green Walking Project to succeed. We need to have a step change, in my view, in the model of care, particularly of the most unwell. So wrapping it up, my challenge to you today is, do you know what you mean by sustainability in your personal life and your professional life? At every part of the journey that you and your children and grandchildren take through society, do you yet feel there are sustainable attitudes to developing positive mental health? And in your local health systems, do you feel, do you know that embedded in it are all the levers that will bring the resources and bring the right models of care? And I'm so thrilled about today. I think the fact we have so many people on the call from every discipline and every sector is a testament to the Centre for Sustainable Healthcare, and a testament to the Green Walking Project, about a group of courageous people, solution focused, who can take us forward into the world that I would love to see for myself and my children going forward. Thank you.
Thank you, Geraldine. Really, really appreciate that perspective. I'm going to move straight on to the Q&A, just to hopefully allow a few questions to be put to you and Catherine. So Geraldine, if you want to bring back your video, and then Rachel is kindly going to chair this bit and pose some questions. Everybody, if you have questions for Geraldine and Catherine, please do post in the Q&A. And Rachel, are you there? Can't see your video.
Yep, I'm here.
Oh, there you are. Okay,
Yeah.
well, I'm going to hide.
Okay, great. Thank you so much, Catherine and Geraldine. Those were amazing and very different talks. So Catherine, obviously, well, I love the idea of equigenic as a new word to me anyway, and how green spaces can make such a difference to people's lives at all ages, and that at every age it is an important factor in our mental health and well-being. How do we use this information, I suppose, to design better healthcare models, but also design within the wider urban context, design better places for ourselves to live in?
I think that, as Geraldine has underlined as well, under COVID-19, we've all become aware that many of us are very fortunate to have the kind of places we can walk in nature within 5 minutes walk of home, but many people don't. And it has been much, much harder for those people to cope with the lockdown. So a physical environment where anyone lives that has within 5 to 10 minutes walk, ideally 5, because it needs to be within 5 minutes walk for it to be easy to use, whether we've got very young children, whether we're very old and have mobility impairment, is part of what is necessary. So landscape planning, green infrastructure, rethinking how we prioritize the kind of areas that we have in our urban environments is very much part of that, and is important, obviously, in my discipline of landscape architecture, urban planning, and so on. And I know that NHS in Scotland and Lothian region is also thinking about how to make part of their estate more available to local communities to benefit in that way.
Brilliant, thank you very much. And Geraldine, in terms of, because we know we have all this amazing information and it's building year on year, fantastic studies coming out. So I suppose the obvious question is why are we not using that better? And you posed that yourself, and you basically said we all need to engage at a local level as well as things happening at a national level. Are there particular things that you have come across that really make a difference?
Okay, I think it's the question every academic asks, isn't it? Why does it take 17 years from discovering what should happen to it actually happening on the ground? And I suppose I look back and I think things happen because you get a critical mass. So things get written in plain English. They become understandable to people. So one of the things that I'm doing is just in a small way is our Zero Suicide Alliance. We have been working with experts by experience, the Mental Health Foundation, public health experts and academic centres to translate into plain English for every single area, by local authority, by CCG area in the country. These are the key factors that you need to address if you're serious about in the place where you are the leader actually addressing health and happiness and quality of life. So we will be launching that in April. We also, and I was surprised at this, we launched a training because we got something like, I think it was £1 million from the Secretary of State, because we're an organisation of partners. They said, well, for that money, we expect you to train 1 million people in something. And we, to be honest, I was kind of thinking, oh Lord, this is a challenge. But amazingly, 1 million people have gone to our website and have looked at the training, which is about awareness, is about saying mental health is possible. Mental ill health can be prevented. And also, we need to do it together, that every single person, so it's not just saying this needs experts, this is saying to every single member of society, a democratization of society, really. You too can do something. You can have a listening conversation with somebody. You can show kindness and empathy in a very practical way that makes a difference. So and that's why I really admire this project, because I think, and I can't wait to hear from all the practical projects, it's about people on the ground translating things into a language that people understand. I think the democracy collaborative movement, the democracy collaborative is a very interesting movement, which is saying that in every area, people can come together to find different ways to explain the world, different ways to work together, different ways to get the right things to happen. Let's not be tied down by what we've always done. So I'm an avowed federalist. I think it's about the power of the people, as well as kind of working with brilliant, clever, courageous people like you guys.
Great, thank you so much. And we've had a question from in the Q&A from Rhonda about how we achieve genuine engagement to enable changes in practice. And to some extent, you've talked about that, Geraldine. Catherine, is there anything you'd like to?
I suppose one of the perhaps small silver linings of COVID-19 is that many public authorities, certainly my own, Edinburgh, is using this as an opportunity to be more radical in their thinking about prioritisation of land use, for example, than they have been previously. And you're probably aware of people talking about more space for pedestrians, for cyclists. But I think also this is the time to now push for good access to green and natural environments for everyone. And I think there is much more of a willingness to be slightly radical as a result of COVID-19 than there has before. So now is the moment for those of us in planning, design and landscape management professions to really push for this, I think.
And can I just say a bit about the use of green walking as for detained patients and restrictive practices? So I think the third revolution in healthcare is the one of having a very different relationship with our patients. It's one of trying to understand what led people to the point where they became detained, what was happening in their environment. And when people are on wards, being able to have those conversations with people, which is about who are they as a person, not who are they as a set of symptoms that met some criteria under the Mental Health Act. And in the definition of appropriate treatment, I mean, for those people that aren't involved in mental health legislation, we're essentially saying three things that people are detained. One is the person unwell to a nature and degree that they've got to be in hospital. Secondly, are they at risk to themselves or others? And thirdly, is appropriate treatment available for them to make it worthwhile, to make it even ethical to remove their liberty? And can we say that our current environment of inpatient units and national funding of mental health infrastructure enables that to happen? We have Section 17 leave on our wards. I would love you to do what I've done. Do a desktop review of Section 17 leave policies across organisations. And you will find that many of them are about how to fill in the form, which form to fill in, when to fill in the form, what to do if somebody doesn't come back. The code of practice, which is the legal document we should be working to, says people are going on leave as part of their rehabilitation, as part of their physical health, as part of feeling very different, as part of understanding what helps them manage. As one of our speakers in the chapter said, people know what they need, but if we use something, if we think that the use of the mental health is a legal process, as opposed to the most intensive clinical intervention, which needs some legal standards, then actually I think we're completely missing the point. And I personally think we do have to ask ourselves, why are the numbers of people detained rising? Is that really not understandable? Can we really not work with people to understand the experience for them to make that difference? And that's why I think the Green Walking Project is just amazing, that you can show people how that can work in busy acute wards where restrictive practices are more common.
Thank you so much. So if there are no other questions from the audience, oh, somebody's just sent one. So do you think
there are lots of questions, and I wonder whether we could ask Geraldine and Catherine if you might be able to have a look through the Q&A, and if there are any questions you can answer in there, that would be wonderful as we go forward.
Okay.
So
I could type a few answers to questions to allow the programme to continue.
Wonderful.
Very kind, thank you.
So thank you very much, Rachel, for chairing that, and Rachel's going to chair further sort of audience participation sessions coming up. So I'm just going to move us forward to learning a little bit more about the guide itself that we're launching today, and then hearing from people who've been involved in the pilots of the Green Beacon sites and their direct learning and experience and reflections on that. So could I please introduce Jacob Kozanowski, who hopefully will appear before you shortly. Jacob is a psychiatry trainee in South London who's been working with us over the last 2 years and is an incredibly thoughtful and generous person and extremely hardworking and dedicated, and has put a huge amount of work into the Green Walking Project and the development of the guide. Jacob, are you happy to take over and introduce the guide?
Yeah, sure. Thanks, Francis. I've just started talking, so let me know if how I'm doing. 1 second. So share screen.
Okay.
Can we see that?
Yes, we can see that. Lovely.
Okay, great. So hi, everybody. I just wanted to probably kind of break the fourth wall for us, that there's sort of almost 90 people on the call and a really diverse group of backgrounds. And just it's something that we were going to do this whole event in person. So another silver lining is that we get to have such a diverse group of people who I think are even some are from across the Atlantic and onto the continent as well. So welcome, everybody. And so I've got the task of introducing you to the resource that we've been developing, and then trying to explain to you why we thought it was a good idea, and I think trying to draw out some of the major themes that we picked up on. So I guess to start, this is just a very, this is what you would see when you actually receive the guide, which you'll all be able to download later this morning. We didn't want to give it to you too early because you'd spend all your time reading it because it's such a good read. So as you can see, we structured it just to put your attention to, I mean, walking is relatively simple on one level. And so we've actually brought the idea of walking and giving you guidance on how to create a walk in the latter half of the guide. But we've really front loaded it a lot with the evidence base, which you heard an amazing description of from both Catherine and also the insights from Geraldine on how this lines up with sort of national health directives. And importantly, the entire guide is built around the incredible work from the Green Beacon sites. So just to kind of go through what I'll be speaking to, I'll just mention the origins of the guide, how it came about, the key themes within the guide, and I guess the three things that I think are really important to bear in mind, and what I think the guide does well, and finally what we hope the purpose of the guide is. You know, there's this challenge that documents on some level end up being not used and their sort of utility becomes unclear. At a previous day, they might have collected dust. I guess we have the advantage of in the electronic that they can be passed around much more easily. So the origins of the guide. Yeah, again, I can't emphasize this enough. And I think like, especially reading more about ecology, I think it's really important to represent that every good effort comes from an incredible amount of collaboration. And this guide is no exception to that. When you look at the acknowledgements, please take the time. I've taken a practice of reading acknowledgements and thanks of anything that I read, because it really gives you a flavor of the incredible work and collaboration that goes into any effort. So this is one of the graphics within the guide, and you can see here that we had 8 trusts. We put out a calling to all 54 mental health trusts in the UK. And our aim, as Francis pointed out earlier, was really just to reach out to as many people as possible. We'd done so much work contacting people that we thought, well, why don't we just get as many people on board? And so we wanted to create a resource ultimately that brought in a lot of the learning that was happening in real time and tying that in to make it sort of as dynamic, live, and sort of real of a document as possible. So something I wanted to highlight and something that brought me and my interest to green spaces was I used to work at the Bethlehem Royal, and I was just stunned. I mean, Peter O'Hare might be here, so hello, Peter, who's the lead OT and does an incredible job at that hospital. But it's not if you have a green space, but the question is, what is your green space? And so these are some photos from the sites, and it just gives you a flavor that I think we need to start changing our understanding of what it is to be in a mental institution or to be in a psychiatric hospital. I mean, there's the estates issue, which Geraldine highlighted, but at the same time, you know, these are adjacent spaces. So I think a real kind of beautiful part of our initiative is that we start really kind of changing and transmuting our understanding and relationship with green spaces. They start undertaking a sort of therapeutic aura, a kind of valence of healing. And when we start bringing that into our minds, I think we become much better at knowing why they're important and being able to represent that to people who ultimately make the decisions around planning and how we organize, I guess, our landscapes around us. So how is the evidence created? Francis mentioned this briefly, but we actually had this idea of having a very simple ask in one sense. But when we basically asked all of our OTs to struggle through an incredible amount of survey work. But we said, all we want you to do is 1 new walk per week. Nothing more complicated, nothing more simple. And in fact, we said, we want you to tell us if you haven't had a walk. Because for us, it's just as interesting to know that a ward is not able to create a walk as it is for a ward to have created a walk. And so every week they would do a survey before the walk, during the walk, and after the walk, and an additional weekly survey about the ward's impressions and monthly update surveys. And interestingly, it was very difficult for people to actually get impressions from the wards, with some sites saying it took almost 2 months for some staff on the ward to even recognize that a walk had been taking place. And we had the amazing number of 83 walks, which, I mean, that's only 83 because a lot of the ones which weren't surveyed and the ones that have continued on after the project finished aren't represented there. So the key themes that I wanted to focus on that I think the guide brings out really well, and this is just simple celebration of the fact that we found that people enjoy going outside. This isn't, I mean, it's great news, but it's news that should be still trumpeted and mentioned. Secondly, this idea of spreading the word and collaboration. Thirdly, preparation matters no matter what whatever initiative you're doing, you need to do it well. And the beauty of walking is that it's so simple on some level, but even to do it well, it takes a lot of work. Finally, the concept of risk. There was a lot of pushback at this initiative initially from various areas about concerns about risks and asking for incredible amount of framing around how to support risk. And again, that sort of ties into Geraldine's points around restriction in the Mental Health Act. And then that finally, green walking is everybody's business. So people enjoy going outside. There's no more to say here. We found here, as you can see these quotes, that people just simply enjoy being outside of the wards. What that says about the ward environment is something else, but there's something inherently enjoyable about being in a green space under the right circumstances. Going on from that, spread the word on the ward. So we spent a real considerate amount of time describing to people just the real importance of shouting about what you're doing. So I guess what we're really trying to do here, and although it seems simple, it's actually quite, it's sort of elegant in a way, is that you need to get the word across to people. We found that where people were able to talk to the doctors and nurses, were able to communicate it through posters, mention it in weekly meetings. And in fact, that's something that we asked all of our sites to do, is that we want you to bring it up before it starts and bring it up on a weekly basis. And what we're doing here, you'll start seeing, is that we're trying to start breaking down this sort of silo effect, which is a general cultural phenomenon within our wards. And I think that's in no small part because of the huge amount of strain that we're asking our healthcare workers to manage. And so it's not just about spreading word across the ward itself, but it's about spreading word across hospitals. Because our ask was so simple, we could go national. We could go across 8 different trusts. And we ended up having this amazing collaboration where each of these wards across the country were able to speak to one another and communicate with one another and share the idea and basically share each other's momentum and energy in spite of all the kind of barriers that they faced. Preparation matters. And again, this gets back to the point that you need to, as you'll see in the walk, there's sort of various stages of preparation, but it's preparation, preparation, preparation. And because every effort done well requires a lot of work, you need to be able to have the entire system of the ward behind you. So that means knowing the patients well, engaging with them, speaking to them about what they want, what's stopping them from going, choosing your walk ahead of time, discussing it, doing it in a shared care planning form, and finally making sure that you've got enough wellies to go around. I mean, there's just no excuse for people to not have the right equipment and the right gear just to get outside. And I mean, this sort of amazing fact that we were so glad to represent, that walking in green space is a safe activity. I know that there's lots of issues and concerns around risk, but again, with proper planning, we've shown that I think green space walking is something that can be done very safely and enjoyed. And most importantly, care is everyone's business. So this phenomenon that we kept on coming across, the silo effect, as it's known in other sort of areas of thought, but walks will be most meaningful when integrated into a patient's care plan and become part of their recovery. And so we found that it was really difficult for our OTs and AHPs to talk to the doctors and nurses and get them on board with the project, even though it was such a simple ask. But where it was possible, you got much more interesting impacts on the ward with a sort of ripple effect across the ward culture, often coming about in ways that people hadn't anticipated, with staff joining the walks and a lot of good feedback coming about. And so this is a major issue, I think, going forward when we're thinking about redesigning care, and why green walking is an excellent first step. So evidence and guidelines. A huge portion of the guide as well looks at the evidence for green walking. And I think a real idea behind that was that we listened to all of our sites and they said, look, we want a tool, we want a resource that we can take to our managers and say, look, there's no reason why we shouldn't be doing this. And so we broke that down into 3 areas, or the areas that you can see here on the slide. There's, of course, the patient care perspective. So this is very interesting for everybody in the audience. There isn't very much qualitative research done on the inpatient psychiatric experience, period, that we've come across. And I'd be very happy to be corrected on that. So what we found was that there's a lot of urge and want to have more holistic, more caring environments, more richer therapeutic environments. And also going on to that, the huge evidence-based summary that we tapped into, as well as the national recommendations, which I think this project follows. And finally, that it fits into the greener NHS plan and the idea and concept of sustainable healthcare. So firstly, within the document, you'll find a 2-page summary of all of the various national guidance within the last two decades, which we feel like the project meets. And most recently, the long-term plan, which highlights very clearly about the need for therapeutic environments to be a real core aspect of adult psychiatric care. We're very proud in the UK to have the Greener NHS program, which has been rolled out, and you'll see that CSH has done an amazing job of outlining why green walking manages to hit the triple bottom line. So as you can see here, this involves the social impacts, the financial impact, and as well as the ecological. And so green walking is an easy way to actually meet the sustainable need that we all have if we're going to have a healthcare system that works for everyone in the future. And finally, the evidence base. Catherine did an incredible job that I'm not going to replicate, but green walking is a really interesting intervention in of itself, because it's able to call on what we know about the interface between well-being in green spaces, the well-known and widely researched impacts of physical exercise on well-being, and finally, if you were to go further into the understanding of exercise, why walking in of itself is good for well-being. And so insight into inpatient experience. So again, another key element of the guide, I think it highlights the fact that there is a real need to change the inpatient environment for a lot of people, and that the green spaces offer real relief from that. And it's something which is adjacent to wards often, and so why aren't we using that? This is an incredible quote from one of our speakers, John Galvin. In ways the ward environment cannot access, walking group creates a space in which conversations can flow and patient internal environments open up. And again, this will be at the end of the guide, so you can have a read of that further. And then this is a major point I wanted to harp on, but how do you create change? And so I think the thing is that we just thought keep it simple, but I don't want to belie the fact that simple also takes a huge amount of work. But because the ask was so small, because a walking group in a green space was so small, we could get everybody who participated to do the best job as possible. And the thing is, once you put that initial work in, momentum does get found, and you use that inertia to go forward, and you get that ripple effect, which is so appealing. And this quote from Rebecca Solent, if you have a moment to look at it, basically highlights the fact that we are able to look at walking that has an inherently complicated activity in many ways, but at the same time, its simplicity allows for a lot of fascinating changes to come about. And so just wrapping up, what I'm looking forward to speak about here is, I suppose, the guide's purpose, which is ultimately, how do you make a document useful to people? And what we're seeing here is that we want to remove the barriers, encourage people to make the first step, spread the word, as in sharing the guide to promote the idea, and inspire others to start similar initiatives. And finally, I think the guide ultimately is an effort towards promoting the access of green spaces for all. So I guess that wraps me up. I think I was hoping to do that within 15 minutes, and that's everything. Thank you, Francis.
Well, thank you, Jacob. Thank you. I think it comes across how much thought and work has gone into making the project as valuable and actually practical as possible. And that the practical side ranges not just from kind of having the wellies there, but actually that connection into the whole of the ward culture and the different staff groups. So thank you very much. I think we couldn't hear from anyone better than John and indeed Julie in a moment about their experience and what they've learned through the Green Beacon, being a Green Beacon site. John, are you there? Are you able to activate your video and microphone? John is an occupational therapist in Cornwall and has given some of the most thoughtful insights, many of which are quoted directly in the guide and presentations. I don't know if
can you hear me?
Oh, we can hear you and see you. That's wonderful.
Okay, I'll just crack on. Yeah, my name's John Galvin. I'm an occupational therapist and facilitator of the Green Walking project on Carbis and Perrin wards on the Acute Mental Health Inpatients Unit at Longreach House, which is a psychiatric hospital based in Camborne and Redruth, and part of Cornwall Foundation Trust. I'm just going to talk to you about the background. I won't go too much in because you've just heard from Jacob, touch on that, but how important the background, the support from Centre for Sustainable Healthcare was so important in making the Green Walking Group a success at Longreach House. I'm again going to talk about the importance of occupational therapy-led Green Walking Group that it's more than an activity, that it actually has an opportunity to assess patient well-being and can influence, we'll say, fast tracking potentially a patient's pathway. And then I'll talk about how green walking in and of itself is transformative to the patient. I'll talk a little bit about that and how, again, occupational therapy tools can capture that transformation quite easily. And then finally, a patient was going to feedback, but because this is a recorded session, the patient declined, understandably. And just talk a little bit about plans for the future there. So in terms of background, I can't say enough how supportive the Trust, Cornwall Foundation Trust senior management from the start, my Band 7 lead and subsequent Band 7 lead today as well, equally supportive, as well as all the director of the mental health funding us to be involved in the first place. We were really grateful when our application was approved by the Centre for Sustainable Health, and from the get-go, the ward managers particularly, there was unquestioned support of the walking group. In relation to the conference, that was really important because it provided the material, so that there was a conference organized. Jacob and Francis helped to set it up, and that provided the raw material in which to inspire setting the walking group. It provided a network. For example, Julie, who will be speaking late after me, we were able to tie in and talk and share how our progress was going, because it's no mean feat starting from scratch, setting up a walking group that's to run every week. And so that material, that evidence-based material, particularly Rebecca Crowther's reflections on her work on transformative, the idea of walking group being transformative, and the model of transformation, that was quite inspiring to hear. I've also involved her thinking in reflecting the transformative aspects that we could see anecdotally in running the walking group. So the walking group itself took place every Thursday. Patients were risk assessed. Clinical risk assessment was quite dynamic, based on patient's presentation prior to running the walking group. We provided, you know, the walking group itself had been risk assessed thoroughly in terms of the actual walking route prior to us even starting it. So preparation, as Jacob mentioned, was put in place. And again, that was in large part due to the conference material that we inherited. So we're really grateful for that. Pretty much set it up on a plate for us to really run, I would say. The walk itself is a 2-mile walk to Carnbray. Almost can see in the distance where I'm sat, just outside in the green space in Longreach. And yeah, it has beautiful views of the countryside, of the Cornish countryside, and Atlantic Sea views looking to St. Ives. It's really therapeutic. One of the sad aspects, actually, that, when I started it off, was a long-term admin staff had said, "Gosh, we've never seen this before." And this is a person who's working for at least 10 years. And I was kind of sad about that because, you know, it's just so immediate on the doorstep. But thankfully, things have changed and people are using Carnbray now more and more. And I would say in part due to the walking group. So after the walking, patients returned to the ward, they would give feedback, and we would document that in a clinical note, you know, highlighting participation and engagement. In terms of the occupational therapy, the significance of the occupational therapy-led green walking group to assess patient well-being, we used Moho tools oftentimes. It doubled up as a community assessment, and as touched on prior, we've actually got experiences of where the data that we were able to feed into the ward round actually led to simple things like increasing Section 17 leave and considering fast-tracking discharge path, you know, where the green walking provided, you know, a presentation of a low-risk patient. Well, why don't we, you know, do a home visit now? And so that was very important. And in addition, talking in terms of the transformative aspects of green walking in real time, I've got a case of a person, Sheila, we'll call Sheila, admitted due to psychotic relapse, presenting very paranoid on the ward. Fear of being raped by males was a constant fear for her, and oftentimes being disengaged. One of the things was for Sheila, walking was an interest, and from the point of view of transformation, when Sheila got to the idea of joining in the walking group, just before the walking group, she would go through quite a transformation from looking quite glum and dour, dressed sort of, you know, without any sort of purpose. She would come alive, and she had walking gear, and she'd put on her walking boots, and it was quite a transformation. Within herself, she was making decisions that were really positive. And interpersonally, while she expressed concern about who was joining the walking group, she appeared to be assured by the shared interests that we all shared in walking group, And so one interpersonal transformation that really stands out in my mind is, as we're going up Carnbray Hill, we all were kind of getting a little bit tired and kind of out of breath because it's a bit of a steep climb. And Sheila, stating herself, so I'm out of breath, and everyone joining, saying, yeah, I'm feeling tired too, and laughing about that. And suddenly you have a group where Sheila is part, socially included, and that's the same for, oftentimes the same for the members in the group. And at the top of the hill, where it's a little bit more windy, Sheila's got long hair, and I remember one thing that stood out was her hair blowing in her face, and repeatedly remarking on just the sense of relief being outside, and not worrying about, I was saying, oh, are you worried about your wind in your hair, because it was in her mouth as she was talking, and she's like, oh, I don't care. And and that presentation was also noted on the return to word, where Sheila appeared calm, appeared engaged, friendly, which was not, we'll say, the normal characteristics, the usual characteristics for Sheila, spending a long time on the ward. The success of the walking group is that it's continued, and unfortunately due to COVID-19 we've had to reconsider walking group, but there are plans in place. Lucy, my colleague, who's just here, if you can see Lucy, she's the sports technician on the ward, and she's planning to run a kind of a Star Wars type event on the ward, using the garden space, a kind of a marathon event where we record our steps, and patients will be involved in that. Plans are involved to go beyond the silo effect, so maybe my Band 7 lead is certainly spoken positively about the possibility of rolling it out where it's feasible, maybe post COVID-19, to other sites in Cornwall. And of course, then there's research opportunities that may come with that. And if there's time for any questions, let us know.
John, thank you so much. I think it's just, there's nothing like hearing the individual stories to really bring it to life, and really appreciate that. I'd like to introduce Julie now, who is another of the Green Beacon leads, an occupational therapist in Kent. One of the things I always think about with Julie is she told me that she quite identified with those patients who find the ward environment quite restrictive, and just actually the more restrictions that you place on people, the more kind of rebellious and how I actually quite can sort of intensify people's desire to break the rules and things. And she mentioned she thought this might be because she went to boarding school herself. Julie, are you able to activate your video and your microphone?
Oh, are you there? Can you hear me?
Yes, we can hear you.
Can you see me?
Not yet.
Choose virtual video settings. Is it, or is it that one?
There should be at the bottom of the screen. There's a
start
an
video
icon with a video camera. Yeah, exactly.
And then there's 3 options there. So video settings it's got, or
you should just click on it without needing to write. Don't click on the arrow. Just click on the main camera icon.
I have done that. Oh, okay. It's allowed me now. Has that started? No.
No, but we may be able to activate your video from this end. Let me have a go.
Start my video. Here we go.
Oh, there you go. You've done it.
Ah, well done. Very nice to see John, and I could hear his story was sort of like rather similar to mine, but sort of parallel stories, if you know what I mean. So it's good to see him outside. I thought it'd be nice to do the same, but I was frightened of the wind, so I'm going to do a simple one. What I've done is I've put all the photos of the Green Walk behind me in my kitchen, so just to sort of cheer up the kitchen. Okay. You frozen, or are you able to see me or not?
We're able to see you very well. Yeah, I'm just hiding myself because I'm not the main thing.
All right. Well, I shall start now. Sorry, I'm very perturbed with this new systems, but I'll do my best. Okay. So my name is Julie Delahaye. I'm an occupational therapist and I work in Kent and Medway NHS and Social Care Trust. I'm going to present to you the Green Walking Project, what happened here. And I'll briefly talk to you about how I promoted the project, how the walk went, and finally, I have some very exciting new news hot off the press. So I'm based at Priority House in Maidstone. It's an acute mental health hospital, which comprises of 3 adult wards and an adult ward, or older persons ward. April last year, Chartwell Ward was chosen for the Green Walking Project. It's a female ward, primarily with a diagnosis of EUPD. And we chose this ward because research shows that women are less likely to exercise than men, and because it's a very challenging ward. So being part of the project across other sites in England allowed us, one, to offer support through difficult times. For us in Kent, some of the senior colleagues were quite negative initially. I think there was a fear that patients would go AWOL, but they never did. And one senior manager said, if they can walk, they can be discharged. Highlights rather a lot about bed management with us. But I had a very supportive manager and she helped motivate us to push through these negative vibes. The project participants also shared a variety of ideas on how to get started. For example, John from Cornwall, who you've just presented before me, kindly sent us his walking poster. And we loved his idea of a poster, developed it further, making our own poster and leaflets, which I've got here, and using the photos we took from our very own walk. We invited the physios, OTs, our chaplain and the OT students to support us in getting the walks going. We also set a Thursday afternoon, it's obviously the best day for a walk, and advertised this in the ward's therapy programme. It was important to allow time to talk to our ward colleagues to identify suitable patients. And we didn't just choose informal patients, we saw an opportunity to positively risk take with particular detained patients. An hour before the walk, staff were involved in gathering patients, checking section leave, very stressful, and making sure patients were dressed appropriately. In our experience, patients usually go out to Tesco's and have a smoke while they're out on leave. The Green Walk offered a healthier option for time out. The walk was an hour long, including a break halfway for refreshments. We took a picnic rug and water and sat down and enjoyed the view. Besides the usual benefits of walking, nature has its own power of healing. When you enter the woods, you stop. You're mesmerized by its beauty. The chatter in your head stops, the tension falls from the shoulders, and the breath takes on a more relaxed pace. The person behind the illness is revealed. We saw the patients as a person, and they saw us as people. It's because we spent more time with them in a more natural environment. And we soon realised that we looked forward to the walks ourselves, and this added to the staff's well-being too. And the more times we did the walk, the more confident we became, and the better it flowed. For example, during one walk, one of our patients experienced an epileptic seizure, and another patient helped us with the situation. He was a competent first aider, which was wonderful. We coped well, but we learned a lot about planning future walks. For example, 1, have a buddy on the ward to phone for safety. 2, know your exact location. This might seem straightforward, but can appear to be difficult to describe when you're in a wood. We found an app, it's called What 3 Words. It precisely identifies your whereabouts in 3 unique words, anywhere in the world. And the emergency services know about this app, and they can then pinpoint where you are very, very quickly. So like John, unfortunately, our green walks are put on hold at the moment because of the social distancing issues, because our wood walk is very narrow. So it's very difficult to do the 2 meters apart. But we really look forward to getting back to walking in the woods as soon as we can. So now I'm going to talk to you quickly about how we promoted the project. We wanted the green walk to go further than our site and to keep it going across Kent. So here's some tips. First of all, whenever we had visitors to our team, whether it be a student, the chief exec, or a visitor from another team, I'd always choose the Thursday for them to come and visit, so they could join us on the walk and experience the benefits for themselves. It's a winner every time. And the communications team manager came on one of these walks and loved the idea so much that she wrote an article about the Green Walking Project for our Trust's Connect staff magazine. The team also then employed a professional photographer who took beautiful photographs of the walk, which were then used in the posters and the leaflets that we use now. And we use this promotional material for recruitment, preceptorship days, as well as when we go to exhibitions at the county show, etc. It's just a really lovely way to engage with people. The communications team also put adverts out requesting donations for the walk, and we received some really lovely gifts of coats, a backpack, reusable plastic cups, bird books, etc. Wonderful. Last autumn, I presented the Green Walking Project to the Trust's Allied Health Professionals Annual Conference. I gave out the Green Walking starter packs and the leaflets and decorated the tables with flowers and fauna. It generated a great deal of interest from other sites in Kent and Sussex, and so far I'm aware all the wards in Maidstone and Canterbury are green, well, they were green walking up until now, plus the Dartford site too, and there may be even more, we don't know. The Trust volunteer team also have been very supportive for us. They've now recruited 2 volunteers for the walk. We found that our volunteers kept the group going every week because they turned up and expected to walk. The volunteer team also joined us for the annual RSPB Birdwatch Week, which we went walking with the patients and used our binoculars to count the birds. And finally, I have 2 exciting updates, hot off the press. I contacted the research and development team to inform them of the Green Walk at the beginning of the project. And just last week, they invited me to become involved in designing and developing a new piece of research. It's about understanding what the impact of being outdoors is on our physical and mental health. And finally, we've also been approached by a TV production company who want to do a feature alongside the lovely Chris Packham from Nature Watch, hooray! And it's about exploring the effects of birdsong on people in distress or in stressful clinical environments. This is such exciting news. So hopefully, I've not lost you.
No, that was absolutely perfect. Thank you very, very much, Julie. So exciting. Just to hear how things have kind of connected in the trust and are leading to new things as well. Rachel is going to take over the reins now and chair a little bit of a panel discussion between the people who've contributed so far, but also we've got a new person joining, which is Rachel Banister. Rachel is a co-founder of the campaign group Mental Health Time for Action, and she's a carer rep on the Royal College of Psychiatrists Council. And I think I mentioned earlier, she's also a part-time primary school teacher, so I'm not quite sure how she manages all of that. But welcome, Rachel.
I mean, I've had experience of forest schools as well at one of my previous schools, and I also teach early years, so the outdoor play environment is fundamental really to how we teach. Sorry, yeah.
Great.
No, fantastic. So I actually count it a triumph that we've reached this point running only 10 minutes behind. So we have actually got quite a lot of time for the discussion and to pose some more of your questions to people. So enjoy it. Thank you, Rachel.
Thanks, Frances. Thank you so much to those amazing presentations. And Jacob, it was great to hear about the guide, and then we'll come back to John and Julie for some specific questions about stuff on the ground. Rachel, I wanted to start with you possibly about what you think. You've seen the guide, and you've met some of the people involved. What do you think is the reach that we could achieve with this? What's the sort of scale that this initiative?
I've just, first of all, thank you so much for involving me. I feel so passionate about this. I've got quite a varied experience as a carer, but also I did spend some time in a psychiatric unit myself. And I don't think it's until you're in that position that you realise, as many of us here today, how privileged we are. I'm sitting here, I've got the patio door, I can hear the birds singing, I can feel the sunshine. And when I was first hospitalised, quite unexpectedly and suddenly, I don't think I understood until that point how much that meant to me, and how absolutely terrified I was just being imprisoned in this hospital, because it did feel like that. And initially I wasn't even allowed to go outside into the to the surrounding areas, into the gardens, and it had a really detrimental effect, I think, on my recovery. And it wasn't until an occupational therapist got involved and she started doing walks out into nature that I really started to feel healing. And I love that quote that Julie mentioned earlier. What did she say? That the person behind the illness is revealed. And I think that's exactly it, because when you're in hospital, when you're really poorly, it's where you are, it's not who you are. And it was on those trips out that I started communicating with other patients that I wouldn't have done normally, and that I felt the staff really took time and saw the real me, you know, not that poorly person I was addicted to benzodiazepines. You know, I was in quite a bad way. But and I started to develop a trusting relationship with them. I think it's something that should be a given, really, but it isn't, is it? And you know, I've heard some of the comments from managers and people that have felt quite wary about doing this. I think it's something that should be a human right for anybody that's in hospital to have access to nature and to outdoor environment. I don't think there's anything in my area, Nottingham. I'd love to do what I can to take that forward. So yeah, I feel hugely passionate about this, and it's been fascinating hearing all the different perspectives. Yeah, sorry.
Great, thank you. Thank you for kicking us off. That's brilliant. Coming to the others, and Jacob, thank you so much for whizzing us through the guide, which, as you said, we'll send to everybody at the end of this session. So I think that the thing that stood out for me from what you were saying was that it can be used as a catalyst on two different levels. One is a very practical one, which is about how do we actually do these things, and that's really what it's intended for mainly, but also how we can use it to advocate for changing models of care. Could you say a tiny bit more about that, Jacob?
I think for me, it's very much about the fact that we've done our best to bring together the experience of people who have been in mental health care, but also people who are providing it, and listen to them and try to create a sort of distillation within this guide that people can just take and just go straight to management. And just say, look, like, this is the passport. You know, as John said before, we put a lot of effort into our event in 2019, and people walked away because we put so much work into thinking about all the different avenues and all the things that might not be expected. And I think the guide does that. And I think we were really conscientious to not make something that people might sort of breeze through, but can actually sort of flip through the most important bits and sort of anticipate the kind of questions and barriers which we spend a lot of time trying to understand. So I think that's probably what I think that the document can do.
Great, thank you so much. And obviously, so the other thing to say in relation to the guide is that, so we've got together as it were, the paper version, which is a PDF at the moment, and that's available. We're also putting it online in an electronic format. And what we're hoping to do then is to set up a page for each of the green walking projects so that they can have their own page and upload their own photos and things like that. So some of the questions have been about how that this group continues to discuss issues after this session. And just to reassure you that we will send around links, and we may not be able to share everybody's details because of GDPR. I'll check, because at this point, normally if we were in a room, I would ask everyone to put their hands up if they didn't want to, but we can't easily do that. So I'm hoping that Ben possibly will advise us on that. But in terms of how people interact with this group and going forwards, how we might continue to share the experience of people on the ground, we're working on that, and that should be available off our main website. So make sure we have those links. So John, it was fantastic to hear from you outside, and I think the other thing that came across really strongly from you and Julie is the importance of working very closely with OTs. So for those on the session who aren't that familiar with mental health inpatient settings, is it possible for you to just briefly say, as an OT, what your role is and how that relates to other people? Because one of the things is about, you know, how we get this to work in different settings. And I haven't lost John. John, hi.
Yeah, hi.
Hi.
I guess in terms of walking, to quote founding mother of our profession, Mary Riley, the quote is, "Man through the use of his or her own hands can impact the state of his, her own health." But I think in walking, it's man, woman through the use of their own legs can impact the state of their health and well-being. Really the role of occupational therapy is to promote patients to be able to look within themselves through engaging in purposeful activity, to find meaning that allows them to contemplate you know, how well they want to be in terms of quality of life, in terms of their self-care, in terms of other routines like being productive and you know, finding fun in life. And for patients on the ward, we provide that through providing meaningful activity, scheduled activity, and walking group would be one, but also we look at, you know, functioning in terms of how through MOHO, Model of Human Occupation Assessment tools, we're able to track people's progress, and it's, you know, it is extraordinary listening to Rachel, you know, how wellness is achievable, and you know, there are degrees of wellness, and it's very person-centered, and that's our role is to you know, to support patients to be as independent as they can be, and whether that involves support to be independent, that's our goal.
Thank you. Yeah, and so this thing that came across really strongly of people being themselves when they go outside is such an amazing, as you say, transformative experience, really. And I think the other thing you said that was important was that you know, this is not just activity. It's an interaction, and it enables you as part of the caring team to assess the patient, and to allow the patient almost to assess themselves, which is really interesting. So there's a couple of questions here for Julie. So one is, Julie, from a clinical point of view, do you find that patients engage more with you, or in a different way that facilitates their general treatment? And also a very practical thing, what's the general staff-patient ratio on a walk? Do you want to answer?
Yeah, again, if you could just let me into the video, that might be helpful, but I can still talk without video. So, yeah, it's normally, you always have to have one to be able to walk anybody home. Oh, thank you. You've always got to have one person to be able to walk patients back. So if they change their mind halfway, you've got to have one person. And then it's always good to have one person at the front of the walk and one person at the back of the walk. So it's normally about a minimum of 3, preferably 4 staff, or 3 and a volunteer. And you always have to put me at the back because I'm a fast walker, and they needed whistles to whistle me otherwise, because we never counted each other because it's just horrible, yelling at each other. We had a little whistle, and they'd whistle me back a little bit because I'd march ahead. You've got to avoid the stretch. But the more people you have, because we started very, very quickly to actually not just use Chartmore ward, we actually had 2 other adult wards and an older person's ward, and we incorporated it with the physiotherapists particularly, and that really helped. But a minimum of 3, preferably. And also, if you think about the more staff and volunteers you have, the more rich the conversations you can evoke, because different people did different things. Some people started singing spiritually, it was lovely to just spontaneously. Others, we had a tape measure if they wanted to measure the trees and do the tree ringing and see how old the trees were. There's special places where we stopped to look where the badgers were, but they also did their own things. We just enabled them, and that was this is the bit. Whatever type of walking group you have, it's just to get people going. And once you get people going, they remember the walks when they were children. They remember all the mythology of magpies and, you know, sort of little stories of their childhood, which are sort of ingrained in our society. It's wonderful. And there's a lot of, and they love the dog walkers and the people. So all you have to do is just get going with it. And then you can link up with other community walks in your area. That's not the difficult bit. It's the background bit. It's the engaging the staff. It's the engaging the staff. It's just getting the sections of paperwork sorted out. But as soon as you get on that walk, they're all like that. We had some patients that were jittery, like sort of anxious horses, sort of, you know. But as soon as they started to walk, they actually calmed down. They actually helped the others.
Brilliant. Thank you so much. So Rachel, there's a question here from Alan. So how strong are service user and carer voices in the area of nature connections? And are there many advocacy groups wanting services to open up to more nature connections in your experience? So Rachel, I don't know if you'd like to.
Yeah. Well, just my personal point of view, when I've been, when my daughter's been hospitalised and the people I've come across, I think it's something that we all feel very passionate about, whether we're ex-patients or carers. I mean, just one example of where we didn't have access, my daughter didn't have access to outdoor areas, and the self-harm and the negative dysfunctional behaviour that occurred was really phenomenal, and made the environment actually very unsafe, and she was discharged with a very low vitamin D level. So that's sort of one end of the extreme, but I think it has got a lot of us thinking and talking about it. I mean, I'm personally an advocate for it. It's something that I'd like to include in our campaign group, which hopefully is going to be a charity quite soon. That's Mental Health Time for Action. And I would love to share my details and to link up with anybody and do anything I can as part of you know, the Green Walking Project and the sustainable, you know, your sustainable, just remind me what it's called again.
Yeah, the Centre for Sustainable Healthcare. Yeah.
I don't know if that helps. Somebody might want to add a bit more.
Great, thank you. I wondered also if you could possibly talk, you know, about a little bit more about on the ground, in your experience, what were the sort of key enablers for the walking group to happen, or what might have been some of the things where if you'd arrived on that ward. I mean,
I think as people have raised, I mean, staffing is an issue, isn't it? And it does highlight the fact that a lot of these units are running with inadequate staff and possibly too many bank staff. I think this ward I was lucky because we did have, this is when I was in hospital and OT, who clearly, it wasn't part of this formal Green Walking Project, but obviously understood the importance of nature and getting out there. So that was up and running. I mean, when the outdoor thing sort of fell apart at this hospital in Scotland, it was purely down to staffing, because the staffing was cut in half, and then we lost an OT, we lost an art therapist. So I do think that is an issue. But having heard what a lot of you have said, it seems to be very much more, very much easier and simpler than I thought it would be. But I guess there will be people that will worry from a risk perspective. But you know, Julie and John have been really reassuring on that. You know, it's not really rocket science. It's not that hard to do, is it?
Absolutely not.
To volunteer, do anything locally. Sorry, I have a habit of rambling on. I'm not sure if I'm what else you wanted to say.
Great, thank you so much. So yeah, I don't think we'd like to give the impression that it was easy. Don't know, John and Julie, if you want to.
My view always is, where there's a will, there's a way. And this is something that nobody could argue that this isn't of huge importance. I mean, for me, during this COVID lockdown, I've noticed the deterioration in my mental health, and the thing that's keeping me going, however hard it is, and some days, because I don't sleep very well, it's incredibly hard. I go on a long walk to our local park, and I can't tell you how that has helped me. You know, it's stopping me doing things, negative dysfunctions that I would ordinarily perhaps be doing. You know, the Birdsong, people have talked about that. You know, I've never noticed and picked up on so many different bird species. There's particular ducks that I check in with on my walk, and I've watched the ducklings grow. It's as a society, I think we've moved too far away from nature and an understanding of its fundamental importance. I think we have a chance now, post-lockdown, to really hold on to this and to create a different society, but also to create different ward environments. Yeah.
And it would be fantastic if people in the audience could kind of, in the chat box, post how they think we can hold on to this stuff post-COVID, because I think that's a general, you know, there are lots of people wanting to do that, obviously, and it's how we do that, and there are lots of different parts to that, obviously. So, but Julie and John, on the wards, in terms of COVID, you've mentioned briefly in your presentations that things have had to change a bit. Do you think is it going to be easy to get back up and running if once we're allowed to? How will things change, and is there anything that positive that we learn from that as well?
I think a start for unlocking is small groups, like a few people, and also not our walk is quite, the one that we do on a regular basis, quite narrow through the woods. So I think it's about also just using the open spaces. And also I think it's essential we start care planning it in so that it's planned, its section leave is organised, and it's just written in right at the beginning. So it's an assumption that's going to happen.
Yeah, great. And John, anything to add to that?
Yeah, I'd share with the view of, you know, what Julie's just said is care planning it, and it probably, for now, it'll be person focused, and you know, advocating, you know, people using their section leave where it's escorted, that staff should be able to escort to go walking. I mean, one of the things, as I mentioned before, the walking group has helped to sort of normalise the idea of going to Carnbray. That's something that's quite that's certainly a pattern. So yeah.
Fantastic. Great, thank you. Adrian, did you want to jump in there? Because I know you're in.
Yeah, thanks, Rachel. I guess in terms of making this sustainable, I think there are a number of things that you need to have as a sort of a baseline. I think first of all, you need high-level support. So either from your trust or your organisation, even at board level, or your local service, the management, they need to really sign up to it. And I think in terms of making it sustainable, that's essential. I think you also need somebody to champion this. And obviously we've heard two great champions in John and Julie, and of course, Jacob. So you need somebody who's really going to drive it and keep it as a priority. I think another important aspect is that the experience itself needs to be co-produced. So people who work in services and people who use services, you need to design what the access to green spaces and what the walking actually means, because not everything will appeal to everyone, and you need people to have variety and some choice within that. Not here's the walk, let's go on it. You need some real variety, and you need you need some people whose job it is to actually implement this on the ground. And I work in a secure service down in Devon, and we took the view about 15 years ago now that we needed some dedicated individuals who are our sports and activity workers. So every ward has access to a sports and activity worker. They work very closely with OTs as well, and actually the rest of the team. So because Rachel's made the point that the workforce is often very challenged, that it's very easy for this to become the last thing on the list. And we wanted to make it something which was an absolute priority. So you do need some dedicated individuals on the ground. I mean, two other things. You do need to create some lovely spaces. And on our site, we're very lucky. We've got a 110-acre site. We created something called the Buzzard Trail. And again, we co-produce this with service users. And it's actually a walk, a trail that really takes you, it's just on the boundary of the hospital, but it kind of takes you away from the more sort of intimate parts of the hospital. And you can actually do some imaginative things even within the confines of a secure unit. And we were very lucky as a unit last year that there was a competition to win the Duke and Duchess of Cambridge's garden from Chelsea Flower Show, and a service user and our manager put the bid in. In fact, we won it. So within our secure unit, we've got the Duke and Duchess of Cambridge's garden. So how good is that? So I think you do have to have leadership, you have to have variety, and co-production is key to all of this.
Great. And what are you going to do with the royal patronage now? How are you going to?
Well, use it shamelessly. It's within a secure garden, but it is actually a walk. It's got little sort of bridges, and it's got a fountain, and it's a lovely space, and we treasure it really for that more than the connection with the Duke and Duchess of Cambridge. But it's still, hey, that's still pretty cool.
Great, thank you. So lots of exciting things happening. And Julie, there was a question earlier about you know, a bit more information on the effects of birdsong. So several of you have actually mentioned birdsong, the B word, the new B word. Do you want to say a tiny bit more about that?
Well, I don't know. The BBC's approached me about this birdsong, and it's also just, I don't know much more about it than that, so I won't blag about anything that I don't know, but I will go on a little bit about birdsong. Is that when we did the walks, when you do the preamble risk assessment walk down before you take patients, part of that was for me to take photographs, but also I recorded the birdsong on the walks for about a minute, and then I walked to another bit of the wood and then do the other birdsong. And that was a winner. You'd play it back to the patients because they go, oh, I'm not sure whether I'm going to go on a walk. And I said, well, listen to this. And then they'd listen to it, and then they go, ah, yeah, I'm going to come on the walk. So there's something very, I don't know.
That's amazing.
And I think, you know, it's something in our childhood. I think when when the traffic is quiet, we can hear the bird song, and it just lifts your spirits. I think the whole thing is, nature has this wonderful distraction. Brilliant,
thank you. So,
because some people will need help to be motivated, won't they, to get out of the ward, and that's just such a beautiful, you know, creative way of doing it. You know, that would have got me out there.
Sounds like you didn't need persuading. So we've got to make this happen. Obviously, you know, we're all convinced, and you know, we've during the putting the guide together, we've explored some of the barriers. We've tried to help in the guide to see how we might help other people through those. Obviously, you are all going to be vital in making that happen. And we are determined to, we've got everybody involved. We've got, you know, patients and carers and psychiatrists and OTs and national leads. And Adrian's underlined the importance of co-production. So I would like to finish this session by just saying a huge thank you to all of you for being involved, for giving your time, for putting in a huge amount of effort and energy. And just to say that we are determined that this becomes the norm in every place in this country, at least, if not everywhere in the world. We'll start with this country. And thank you so much to all of you for your huge help with all of that so far. And I'll hand over back to Frances if she's there.
Hello, hi. I am here, and I'm going to hand over to Jacob. And Jacob, I think, wanted to bring in a last comment from one of the other Green Beacon leads. Jacob, would you kindly wrap up the event for us with the help of Devon?
Yeah, of course. I was just going to start with just introducing Devon Wells. I know that you're still there somewhere in the kind of virtual sphere. Devon was just telling us that unfortunately her walking group was on hold, but hopefully is going to be working towards going back on in the next couple of weeks. And I guess I wanted to just bring up Devon again and just to kind of reiterate this point that there's so much behind this work and that there's so many people participating, and that Julie and John did an amazing job, but alongside them there were 6 other sites, and a lot of those people who are working so hard are also within this call, and we, you know, with all the participants that we have. That includes Sophia Awan from SLAM, the Birmingham. I mean, I could just, you know, if I could have a choice, I would just do an entire acknowledgement list for 60 minutes because I'm just so grateful for everyone's help. I'm just going to go back to sharing my screen for a second. Frances, you let me know if that's working.
Yeah, looks great.
Great. Okay. So just to bring us up, we've been sort of flying through the virtual sphere for the last 2 hours. Time has really blown by. An incredible contribution from everyone. And I just wanted to mention some final comments on green walking, which I think I've been keeping in the back of my mind and hopefully kind of get at what makes this so important. Just to kind of remind us about what the mission was, which is to provide respite and healing to people receiving inpatient psychiatric care through walking together in nature. And I mean, it's just, you know, on some level it is starting a walking group, but again, it's just about starting simple and then believing that something more can come out of it. Now, this is something that I've brought up in previous times that I've talked about, and I think it's really important to highlight that we sort of forget about what evidence-based care really is a lot of the time. We just think about what the evidence is. But I wanted to highlight again that evidence, and I think what this project tries to do is that evidence as we understand it, if it's going to inform care, is very much about bringing together 3 different spheres of knowledge. And patient values and preferences is a key element. There's not a disproportionate sharing of that role. It's something which is shared across these 3. And I think, again, it's something to bear in mind when we're thinking about how we're going to make services better and more sustainable in the future. Now, this is something which I think Adrian and so many others have said so well, that shared work is good work. And that means working across the board. It means that, you know, I've been so struck by hearing leads and services having a vision of what they want, and then somehow it goes down to the ground level and it trickles out. But, you know, we also need to lead the leaders, and it needs to go both ways. And all work that is done well is ultimately a shared collaborative opportunity. And I think that the green walking is an amazing opportunity to do that and to make that real. And then this is something which I can't emphasize enough, but a simple change made well has a strong ripple effect. We heard more in detail from Julie and John that, I mean, just planting a single seed, so starting a new walk, you get things which you just can't anticipate. And so it takes a bit of faith, but to have that faith, you need to have support across the board. And so starting off small is something that shouldn't turn us away. We don't need to sort of change everything, but it really is just, as Julie eloquently said, it's taking that action, planting that acorn, and then just waiting and nurturing it and doing the best that we can and realizing that we're always doing things together. And I think this is a really important point that stretches into the kind of world that we're living in at the moment, that, you know, our green space is just a place for us to kind of move through and not acknowledge. You know, I think a lot of people kind of intuitively realize that they're getting some kind of restorative effect from being in a green space. So a lot of what we're hoping to do with this project is that we start shaping our understanding of what it means for a green space. Green spaces, as you think about them, they should associate immediately with the fact that they're therapeutic. And then we'll be in a much better position to look after the planet, to look after our ecosystems, and to kind of start building up the world that we're all hoping to be inheriting and moving into. So just to finish off here, what you can do, I mean, it's simple. Go out and start a green walking group, whatever service you're in. We at the Center for Sustainable Healthcare are always looking for collaboration and support. By no means, we have some ideas about next steps, but we very much need as much support and collaboration. So please get in touch with us. We'll be sending out an email with contacts and everything that you can to make that the case. Also, just as a reminder, there's a feedback that we'll be emailing, and we really appreciate that because we can also use that in the future to represent how well this event has gone. Spread the word. So we've got the @GreenWalking Twitter handle, but also look out for Green Walk Wednesdays. And I can't really sort of stress this enough, but just get out into the green spaces and of course do it safely. But there's no replacement for experience. Like they were saying at the Green Beacon sites, getting managers, getting people who visit the ward to go on the walks, it's just night and day, the sort of transformation that comes about. And just to kind of finish off, my sort of unimitable Rebecca Solent sort of says it best in her book Wanderlust, which is a history of walking. When we talk of social change, we talk of movements, a word that suggests vast groups of people walking together, leaving behind one way and traveling towards another. And it starts with a single step. It started, years ago when occupational therapists first started thinking about using that approach for mental health. It started when people started understanding, as Catherine said, millennia ago, about the importance of green spaces. And again, here, everything that's come to this point today is a combination of a huge amount of work from so many people, from the Green Beacon sites, from the grants we've been awarded, from the Network for Social Change, the Maudsley Charity from supporting us, and this incredible collaboration across colleges and as driven by the center. And of course, I wanted to also highlight just the younger generation of clinicians that we've had helping us even up until the last minute, people like Ian and Nina, and we had a number of interns at the center as well who were really instrumental. And so again, please do read the acknowledgements, and thank you very much for joining. It's been a real pleasure, and look forward to seeing what we can do in the coming years. So that's just a final reminder about what you can do, and I'll leave it to Francis to wind us down.
Thank you, Jacob. That's fantastic. I guess all I really want to say is you will receive an email from us after the event closes, and it will conclude a link, which I've also just posted in the Q&A, to the Green Walking webpage, where you'll be able to download the guide and some other resources to go with it, like the case studies. And we're looking for ways to take this initiative forward. And if you would like to be part of that, we would love to hear from you. So do get in touch, please. And thank you very, very much to everyone who's taken part.